This conference will now be recorded.
Hello everyone.
Hello.
Hi Geetika, Smita, Naima, Minu, all Habita. Hi all of you. How are you doing?
Hi, Rashmi. How are you?
Yeah, I'm fine, dear.
Congratulations.
Congratulations to us. Congratulations to Smita.
Yes,
Oh,
yes.
so
Huge,
all of us.
huge.
Yeah.
Yeah, it's a huge achievement.
Huge achievement, yes, indeed. So Smita has also joined us. So without wasting any time, let me just start with what is the agenda for today's meeting. So it's just about congratulating her on getting this gold medal, which is itself, like as you said, it's a huge achievement. Plus, I just want all the students to know about her journey also, like what different she did or maybe what similar things she did, so that that will be more common, I guess. So I just and all mentors, we are all proud of you, dear. You have really showed that your hard work, dedication, in spite of having a small kid also, you have done everything possible, and you took it to 87%, which a great score, I would say. So Geetika, can you just tell something?
Yes, Rashmi. So, firstly, congratulations, Smita. It is such a huge
Thank
achievement, as I have already said, and it feels so great, to be mentor of a gold medalist. And our academy is so much proud of you, dear. And we wish you all the very best in your life, and keep on achieving the best in your life. And we really feel so happy for you. And we know
thank
that you had been a dedicated student, and let it be our sessions, let it be the submission of the recalls. So you were always and always dedicated. I remember listening to your recordings and giving you feedback. So it is an immense pleasure, dear, to have you here, and all the very best in life, Smita.
thank you so much, ma'am. Thank you.
Thank you. So, Geetika has taken time from a busy schedule and she has her upcoming session tonight also. So I said like we'll finish off all the celebration before her session.
Yeah,
And Dr.
definitely.
Satish has joined. Yeah, he's joined from busy OPD over there. I requested him, sir, can you hear us?
Yes, I can. Am I audible?
Yes, sir.
Congratulations, Smita. It is a wonderful achievement, and there are no words to describe what we feel. And I think you must also be feeling the same. Cracking the exam with a gold medal is like the icing on the cake. All the best to all of you, and congratulations to Smita because you have done us proud.
Thank you, sir. Thank you so much.
Thank you so much, sir, for joining in. So, Smita, I just want to quickly tell about our, how we interacted and how the journey just like took place. So, to begin with, we got to know through our common colleagues. So, and we met during our, I think, the all signatures or documentation that you required, the authentication, right? Then it was, yeah, I still remember that. And then it was. We had to conduct a live circuit in Bangalore, and you were one of the role players for us. And you left a small baby, and you came and helped us with the live circuit, and which indeed benefited you towards your exam also. So this was a glimpse about the live circuit and how dedicated role player you were that time, dear. I still remember the placenta previa case, right? And this is when she met me, and she still didn't know that time that she had got a gold medal, right? We just met each other and congratulated you, and the next day you announced like, madam, I got gold medal, right? So it's all about yours. Now students have a lot of questions to ask, and I'll hand over the sessions to you and the students so that they can have an interaction. and just whatever you want to ask with her also, just use this platform. So whatever doubts you have, whatever extra things or something different, or what was your approach to the station or the role players, and how you were able to manage the time and your practice things, I think more of the this kind of interaction the students want now. So the stage is all yours. So students, I would request, please put on your question one by one, or at least you can type in the chat also, if Smita could go through that. And whatever you want, you can ask her.
I don't know if I'll be able to do this justice, but I'll definitely try, ma'am, and I'll share my experience with everyone if whatever
You
they.
will, you,
Yeah.
yes, you will definitely. So, yes, I am recording this, Rahul, so that will be available. So we are recording, nothing to worry. So if you have any doubts, please put up on that, or you can open up your mic and have a good interaction also. Yeah, to begin with, I think you can tell about how you started with your part 3 journey.
Yes, ma'am. So actually, I think before starting, I asked Dr. Rashmi 10 times if I should go through with it or not. And finally, I made up my mind that now is the best time. So yeah, then I joined the regular classes, which started in October. So I think I still remember the first template recording that we were supposed to submit for the general template. So that's how my journey started. And I sent a very extra long template, which has always been with time. So yeah, but then over time I understood how to cut it short and what to remove. But yeah, that's how it started. And yeah, just trying to be regular in the classes, and trying to cover the important topics for each module, because in every class we had to present a case, so we had to know something or the other. Otherwise we wouldn't be able to speak. So somehow in the short time that I had, I would listen to the audio recordings which were already available in the website library, and also many submissions from previous students, and there are some PDF files available, so I would go through the PILs or all of that. And yeah, so that's how I started preparing. It took a long time to get into the groove and also to understand my drawbacks, but yeah, eventually I guess it worked out. So that's how it started.
Yes, so we have a question here. Inam wants to ask, like, how long you have been preparing for part 3?
Okay, so yeah, I started preparing in October actually, and exam was in February.
Okay. And Meenu wants to know how many stations per day you were practicing, like as a bare minimum station. Much you have to do, kind of.
Yeah,
Yeah.
I know that everyone says you should be practicing more, but frankly, I have a small baby, and also I was working till almost 5th of Jan. So it wasn't possible to have any set target, but I had a study partner with whom I had also prepared for part 2, and we know each other from a long time. So generally we used to try to discuss as many recalls as possible together, because we realized that whenever we are recording and submitting, or we're just doing it by ourselves, it's actually not that effective, because you don't, I mean, in the real exam, the role players will take you in their own direction. All the
I think
practice
that
format.
lot of your credit goes to Ankita also being your study partner, and both of you, I know like you have studied it together and you have made it together. So proud of
Yeah.
both of you as a study partner also. Like how many study partners she had? She had only Ankita, I would say that. And how many different cases you used to practice?
So that yeah, that's what for each module we used to try to cover the most important recalls. We never had a set number of cases as a target, but I would say that at least the last few years recalls we would go through. I mean, we have gone through, and initially actually we were trying to solve some of the books. Like we started off with Lisa Joel, which I think is very basic, but it has a good approach, and you sort of understand the UK system a little bit from what they are saying in the
That's
explanations.
a must book in all our, the course students. I say that the first thing I want to do is Lisa Joel. Yes,
Yeah,
Gitika.
Yes,
Yeah,
Rashmi,
she is.
Lisa Joel is the first book you should go through.
Yes, it makes your basics strong.
Yeah,
And
it makes the basic.
yes, and do you have your own notebook or copy paste of others? We don't recommend to copy paste anyone, dear. As long as like you're being yourself and the routine sentences that comes out of your mouth, that makes you stand out. What do you say, Smita?
Yeah, definitely. I think whatever you say spontaneously and in a patient-friendly way, that should be enough. There's really, I mean, I don't remember actually, but yeah, I would say that some things which I found difficult to say when I realized that I wasn't saying it in the right way. So whenever I heard someone saying it in a good way, I would just note that down, like
Yes.
some phrases and words to easily get across to the patient. So yeah, that I would write down sometimes, especially in the
Hmm.
classes or whenever I heard someone else's recording and I didn't have time to practice that station, at least the difficult things, I would just write down those phrases so that,
Hmm.
later, yeah, before the exam, I just quickly glance through those. So I would, have them in my short term memory. But yeah, other than that, I don't really have any notes as such.
Okay, so they want to know you were in different paid groups also.
The regular classes we were only Raise Academy, but towards the end we did some mock sessions. One of them was with Study Medic, the online mock exam we did with them, and one
Hmm.
was with the Decode group, was a online mock session again. So these were the
Hmm.
things. I think if you are in too many things, also it becomes difficult to keep track of it. So I would say,
Yes.
follow one thing properly from start to finish, and maybe there are a lot of free groups where they do a lot of things where some
Yes.
difficult topics, some ambiguous stations, yeah, they did do in some free groups. So yeah, we picked up those, and a few YouTube videos that I saw, like introduction and some short
Yes.
videos for difficult stations are available freely. So yeah, those things I have gone through. Yeah.
So, at having said this, I would say, like, follow one thing which is going to make your foundation very strong. After that, it all depends on how many courses you're taking, how many mentors you're going through. Every person has a different approach. So, it's not mandatory, or it's not like, you stick to only one person or list. In my group, though, I just say, like, free ka gyan, wherever it is there, just take it. It's all yours. But you should understand that what you need to apply from that, that is very essential. Not everybody is going to speak like that same person or the same mentor. It is like your individuality should be there. You shouldn't be a replica of somebody in your exam, and not even your study partner also. I would say build up your own individuality and show that to your examiner. They just don't want the same thing to be said again and again from each candidate they are coming through. So that makes you stand out. You have to listen, you have to understand, but ultimately it is you who is going to present that in 3 hours, right?
Yeah, I agree, ma'am, definitely.
Okay, so other questions like what all topics that you have covered in the last few days, and applied clinical knowledge. You are hero. Okay, yeah, you have to brush up your applied clinical knowledge. I would agree. So, what are your comments on this, Smita?
Yeah, actually, this was a very, because I gave my part two exam in Jan of last year. So, and I had a baby right after that. So, I think in my pregnancy brain, everything flew out of my brain. And I was like, back to zero when I started preparing. So, initially, I really felt that I couldn't speak confidently if I didn't know some of the guidelines. So, I tried to at least go through the summary points, and also anything that I had marked. Initially, I did try to do that, but towards the end, we were so short of time that frankly, there was no time to do all of that. So, whatever we felt we really weren't clear about, only those things we went to brush up on. And reading the PILs also sort of jogs your memory and brings it back, and you also learn the patient friendly language. So, whatever was not freely available on RCUG, we would get the PIs from the NHS website, type in any random thing, and also on the groups, so sometimes it's available, even on the website of Raise. So, whatever was there, I used to go through the PIs at least, so that I covered most of the things. But yeah, actually going through all of the guidelines is not possible in such short time.
Yes, so you should have a smart approach rather than, keep on mugging up the algorithms or something. You should know what should be said and done at that moment. Geetika, I want your inputs on this. So, how the recalls are helping us students, because you are giving a lot of feedbacks for them when we are doing the recalls. So, majority of this is being taken care by Dr. Geetika over here. I should say that, she's a kind of backbone which is supporting our candidates through the Warriors group. And I try to manage all the schedules and give feedbacks in and out over there. So it's a kind of live sessions plus the feedbacks, which are a must. Solving books and this, yes. So our candidates who are joined here, they also know that how the book solving is going to make them strong. So your comments on that, Geetika, that the upcoming
Yes,
students they are
definitely.
now.
Definitely, Rashmi. I think each and everything is very important. And recalls, we all are knowing that almost 10, 11 stations, they are repeats. So it's very important that we are thorough with the recalls, and we start them when we start our preparation. We read the PIL, and then we can go retrograde also. Like we can see the recalls, and then we can read the literature, what particular things are important, which where we really need to focus. So recalls, definitely, I always stress upon that recalls are very, very, very important, and they can actually the role player can modify their sentences. That is a different thing, but you should be
Yes,
knowing the basic idea. You should be having the basic thing what you are going to speak and how the station can come. So I
yes.
always focus that always and always try to do the recalls at least twice, thrice. Each and every station should be practiced. That is very, very important.
Yes, and you should know like what station it is, not like okay, what questions they're going to ask, because role players keep changing. They change the
Yeah, they keep
questions.
on changing their questions. So though they ask very easy questions, it is not that difficult. But yes, you should be prepared for everything, and you should be having a basic gist of the subject. So that's important.
That's very much important. So Habita wants to know any tips for part two, Smita.
um, uh, it was
Guidelines.
very study and
Yeah.
study the guidelines, the GTGs and the nice guidelines. I think if you go through that, and if even if you, I would say, don't go through all of the talks or don't do much of anything else, at least the GTG and the nice guidelines in and out, and that too I would say with a study partner, because when you're reading them by yourself, you can miss out on some things and your understanding might not be very correct. But when you're discussing it with someone, then you understand what you understood and where you might be
Yes.
wrong. So
The
GTG nice
concepts.
guidelines, also FSR.
Yes, so those are all important over there. So can you just tell like what challenges you
Yeah, so that's my
faced
tip.
during? Yeah. Okay. So can you just tell me like what challenges you
So
faced during your exam? It was an online exam for you.
yeah. So I think the I mean, you feel sort of not very. It's not very easy to connect with the role player when you're when they're on the screen, and also
Yes.
they might have a little bit of difficulty in understanding. I know that a lot of people from my batch, they were all saying that because all the role players in an online session were from UK, their accents were a bit difficult, and communication gap was definitely felt by most of us. But
So what helped
I
you?
guess
Yeah. So what helped you pick that accent?
yeah, I watch a lot of shows in my free time. I could say that probably helped me to understand what they were saying. And also, yeah, for the online session, mainly just sitting there in one place throughout those 7 stations, and the screen just suddenly vanishes. You have to
Yes.
shift from one station to another in the span of seconds. Like you don't even have time to go to the next booth. You're just the screen just vanishes completely, and the most difficult part was reading the question and understanding and digesting, because they give long pages of like 3-4 pages will be there, scrolling through that and trying to pick up the thing. So what we actually decided before the exam is that once we read the scenario, we directly go to your task in the next 10 minutes is to and then after reading the task we would come back to the explanation and the investigations and all, because finally by the time you read it, you forget what your actual task is. So the main thing is to like focus on that. So that I would say read the task twice, because they're very specific in the things that they ask for, and you shouldn't waste your time asking for things that are not mentioned in the task. I would say that is what we had decided before going for the exam also, and that helped, because the questions are very long, so that's difficult to read online.
Yes, that's very much important over there, because the online presence and the shift of that frame within a fraction of seconds. Now that the May exam is going to be both face to face and it's going to be like online exam. Geetika had also given an online exam. So what was your experience, dear, during that time?
Yes, yes, same thing, Rashmi. So, you are doing the exam, though I was able to finish most of my stations, but yes, the screen vanishes away and new station pops in front of you. So it is like one after the other, one after the other. So you are sitting at one place and everything is roaming around you. So, but those, I think, 2.5 hours, they are the fastest minutes in your life, and everything goes like this. But yes, they give a break after 7 stations in online. So otherwise it was cool, nothing much to. And even the prioritization I would like to suggest, because most of our candidates know, they are very worried about prioritizations, gynae list and all that. It
I
just think
very
about
hyped
your
up,
clinical
right?
scenarios. Yeah, I really don't understand, because for me it was very easy. In the
Yes.
first station only, they have given just one liners, okay, and then they were giving an evolving situation. And just as if we are managing in our labor ward, so the same way you are going to tell in the exam, there is nothing much they are expecting out of you. But yes, there are some asterisk points. For example, you are not telling high dose folic acid with antiepileptic, so definitely they are going to cut marks. So they are mainly looking at your asterisk points, that you are covering your asterisk points well.
Exam,
So it's
that's it. Yeah.
important. Yeah, yeah,
And even like I have faced like all three of us are here, so I have given a face-to-face in Chennai exam, and that was the time when labor ward prioritization became compulsory stations, in every exam. And I was just like open-minded, and whenever they put up a question regarding a room or this, I was answering. Then he just said, "Okay, you go on street, you manage a ward." So that's it, and it was so spontaneous. It was how to do on day-to-day basis. That's it, and you don't have to think twice of this. Just manage your exam. Shravanti, can you just mute your mic, dear? You just have to be yourself. And Smita, what about the challenges about your labor ward prioritization?
Actually, the first thing that I noticed in that was that they had mentioned that I was to discuss it with the midwife in charge who had taken over 1 hour before me. So
Yeah,
sort of it's a little jarring for me, because generally we practice as presenting to the examiner, but in this I had to discuss with a colleague rather than she wasn't the examiner. I had to speak in a way that I was discussing with her and asking from her, so what did you see, and then
the
we will
presence of
assign
my
this person
people.
or like that.
Yeah.
Yeah, so rather than the details of the labor ward, the noticing that I was speaking to her was more important in that my labor ward station. And in that, I think once you get into the flow of it, you can go fast. We waste a lot of time in saying many things, probably because we practice that way. But in the actual exam, if you want to go through all of it, there's not much time to
Just
speak
be
much on each
yourself.
station. So you have to know what is the most important thing to say in that and keep moving on.
Yes.
So, and also give the examiner a chance to speak, because many people said that they went on and speaking when they didn't realize that it was evolving station.
Yes,
So
yes. That's
if you let them
essentially,
ask the question,
take a pause.
yeah,
Yeah.
take yeah,
Okay,
so
Dr. Rupali. Yeah, I think Dr. Rupali has joined us. Dr. Rupali. Yeah, I think, yeah, ma'am, if you have joined, kindly unmute yourself. Okay, she'll be joining with us. So I would say, like, say, a labor ward, gynae ward, these are day-to-day practice what we are doing. So don't get panicked with the fact that, okay, what if it comes? It is what you're going to handle on everyday basis. So just be yourself. Think about your patient safety. Think where the mother's life is in danger, you have to be there. Where the baby's life is in danger, the next of your whoever is on call, at least they can attend. So you just have to know that, be smart in your approach and never say long sentence. This I always tell to every student of mine, just be like a cautery, touch and go, that's it. If you sit on one particular sentence, you're going to burn that tissue, you're going to burn your station. So the points, very crisp, very minimal, and a smart approach. This should be for your exam. This is what we expect. So Dr. Rupali is supposed to join us. Are you there, madam? Can you hear us? Okay, so any problem that you faced, Smita, in time management in your entire circuit?
Yeah, so the labor ward and the gynae ward were pretty long, ma'am. But I think it was only in the exam that I actually got through all of it, because by then I was, understanding how to speak and get on with it. But other than that, rest of the never really had a problem, because all the things that we practice, that much you can't speak there. As a role player,
Yes.
if you answer whatever they are asking you, you will be able to finish the station. Yeah.
Yeah, that is very important, addressing the concern of your role player, because they'll be have given a set of questions which they are supposed to ask you, and those are the main concerns which will help you in passing this exam. So if you are speaking and if you're not going to give your role player that much time to respond back or ask questions, then those points will be left unaddressed. In that situation, you will not cover those important points which will help you pass those domain, right? So you have to give them also some time to speak. So what do you say on this? How were your role
Yeah,
plays? Were they friendly?
very correct, Rashmi. You should give role players to speak, give time to the role players to speak. It is very, very important. You should have some time left for them also. That is very important while performing the station.
Yes.
I
So the
agree,
other,
ma'am, because yeah, most
yeah,
of the times yeah, I was like forgetting the format also when they started speaking, but they were guiding me and they were asking the questions and I was responding. So that's how it goes, I guess.
yes, yes. And it is very important that when you shift from one station to other station, I always say you have to physically, mentally, just leave that station. Do not carry the good feelings or the bad feelings from your previous station, be it the very first one. And in my exam, the very first two stations were like the gynae ward and the labor ward. The exhaustive two stations were the beginning ones, and then I completed the other circuit. So it mentally drains you out, but it's very important that you leave it off and go and perform every task as an individual approach, never to get affected with your previous station, how you performed, be it good or bad. Just leave it off and go to the next one. At least in Oslo, you'll be getting some break, but in face to face circuit, trust me, it's going to be an exhaustive one. So doing continuous practice is very much essential for you all.
When you are not performing the stations, keep on listening to this, to the audio recordings which you have. Even listening to the things make you so much better. I used to listen and listen. I used to keep on listening, and I used to sleep listening to the stations only, Rashmi, frankly speaking. So it was my continuously listening to something or the other. So that also makes a lot of difference.
Yes, Dr. Rupali is here. Ma'am wants to convey her wishes to Smita. Can you unmute, ma'am?
Yeah, thank you. Sorry, Smita, I was in theaters, but
So, Dr.
congratulations.
Rupali, yeah, she is our consultant from NHS, and she takes the clinical governance from Raise Academy. The part three, all the clinical governance module is covered by Madam. And we were just speaking about your labor ward and the gynae ward, ma'am, about the NHS system and what you expect out of a candidate when they perform this.
Um, Let me first congratulate Smita. It's an absolutely amazing achievement. Well done.
Thank you, ma'am.
Uh, in terms of prioritization, I think it's you just need to see what is the first thing to be. So in labor ward prioritization, mother comes first, then baby. So always remember that. And secondly, you cannot do everything on your own. So you have to be mindful of what team is there with you. So delegation is as important as prioritization. That is the whole crux of it. And try to mention all steps you would like to take in a particular station. There are different ways of doing it. You can either prioritize it as per the emergency, or you can say, okay, number one, you can do this, number two, you can do this, number three, and carry on. So there are different ways of doing it. But as long as you cover all the stations and tick up all the boxes, it should be okay.
Yes, thank you so much, ma'am. So these two are the stations which, scare our students from the fear of exam or something. But these two are not only the deciding factor for the entire circuit. I would say just take them as easily as possible and be yourself that day. This is what is going to build up your confidence and perform every station. Thank you so much, ma'am, for joining in us from your busy schedule. I understand that you're on call today. Thank you so
I
much
know.
for joining us.
No, thank you. It's a tricky week because all our junior doctors are on strike. So it is an
Oh,
interesting week for us.
thank you, ma'am. Thank you for taking out time for us. Thank
Take
you.
care. No, thank you.
Thank you.
Thank you very much. Bye.
Thank you, ma'am. Bye bye. So again, any further questions the students want to ask, you can just pour in your thoughts. So what like take home message Smita wants to give to our upcoming batch? The May exam is approaching now, so you have handed over the torch to the next candidates in the Warriors group, I understand. So I've told them like, the people of February, they are done now. It's your turn that you need to aggressively practice in our group. So what your message for the upcoming, yes, Rahul wants to know about those last days preparation that you need.
Okay, so I would say get hold of someone and practice with them. So you can each day. I'm sure everyone is busy and it's not possible every day to spend the same amount of time, but at least keep at it. As ma'am was saying, when you're not able to practice, listen to other people because there are a lot of stations available on the Telegram groups and on the website. So listening helps to cover up your things, and you also get a different perspective of other people's what they're saying. And
Yes.
the recalls, I would say that practice the recalls, but keep an open mind when you go for, even when the recall comes in the exam, they may not
Yes.
be the same things. They ask different things, so just keep an open mind, and that should get
Not to
so.
panic, whatever the role player asks.
Whatever the role player asked, like try to be in like you would be in your clinic. That's what helped me when I went for the exam. Finally, I was just like how I would be in the OPD, and I think
Yes.
that's what really helped me because frankly, my preparation was not that great. I really, honestly, if I should say, I don't think I've covered as much as many other people would have, but. Finally, on that day, it worked for me because I was calm and I was just answering what they were asking and keeping an open mind and not trying to say whatever I know. So that's
Yes.
what I would say.
Yes. Yes. And he wants to like, should we make notes? I wouldn't say sentences, just bullet points is what would be required, Rahul. And what about you, Smita? Did you make notes?
No time for it, ma'am, honestly. Just no time for it.
Yes, part three is more about practicing, be it in your OPD clinic, be it your juniors, where you're just catching hold of a person and teaching CTG in 10 minutes, or be it an instrument application and teaching your junior for 10 minutes only. If nobody is there, just practice with yourself. So, this is what, like, even I have done, I think everybody does in the day to day time. Notes, I would say just bullet points. Only give yourself 2 minutes time, like especially when we are solving these practice books in our course group. So when you read that scenario, just 2 minutes, and you just have to note down those bullet points which you have to discuss in the next 10 minutes of your voice recording submission. This is what I say. they are there to guide you, but don't sit and keep making notes. This is not your part 2. Part 3 is how you communicate. This is very important. And the more fluent you become, it's only by practicing stations. I would say never think like, okay, what if I say something wrong? No, you have to practice, and only then the fluency is going to come out. Otherwise, that hindrance will be there even on the day of exam. So there are students who have worked even till the day before exam. There are students who have taken break, so it is all acceptable. So nothing great in even taking a month off is also okay if that is working you like better for you. Having a study partner, not having a study partner, nothing should stop you from your preparation towards your part 3 exam. Today you may have, tomorrow they may be busy, but how about that, Smita? Like, did you practice on everyday basis with your study partner only, or you would give time, like some me time to each other also?
It's not possible for us to do it all the time, ma'am, but towards the end we try to do more of it. Initially it was like both of us have different things in which we are strong in, so
Yes.
whatever was lacking, we try to cover up that on our own initially, and towards the end, yeah, more we try to practice together more and more, and yeah, so that's it. Not every day, but most of the days.
Yes, yes. So I think if any other questions are there, just put up in the chat box. Otherwise, you have done a wonderful job. Getting a gold medal in MRCOG is not that easy, and you have done that for us. Thank you so much. And they have given you a list of dates to attend a convocation, so please go to London and attend one. And I want that photo of yours with the medal, so I'll be waiting for that, dear. So we all at Raise Academy, we were looking forwards for candidates to be like strong with their preparation, and every batch I think is just getting stronger and stronger. We can show that, and we trust in our candidates for that. So we are there always for you all. Just and sometimes negative results may come, but it doesn't mean that there is something wrong with the preparation or this. It is maybe that day, those 14 stations, those role players, everything matters. Online it could be some internet issues. Face to face sometimes you're able to perform everything when you're alone or with your study partner, but that anxiety of an exam, those 3 hours, how you perform, that also matters. So just stay calm, take it just as any other exam, that's it. Do not make something like hype about this or something. Be cool. Those 3 hours are like, you have to be yourself that day, because whatever you have studied in the past few months, it is going to matter only for those 3 hours. So I would say do not spoil your 3 hours there. It is very important that stay calm, perform every station as a different one, as an individual one, not getting affected with the previous one. Just go ahead, and you will never realize like how you completed the 14th station. It should be just in one go. um, yeah, last 15 days of planning and last day before, should you study or not? And how many stations? Yeah, she was telling like how many stations you have to practice per day. So Priya, I think she joined a little late, so it depends on your time, what she said, like how much you have. And Shravanti wants to know like last day before, whether you studied or not, and last 15 days, what was your planning?
So last day, Ankita and I did say that we would stop. But then, just sitting and not doing anything also was getting to us. So we didn't really read anything, but we did discuss few things with each other and just try to go through the flow charts in the guidelines, so that, especially all these risk factors and all of that we always keep forgetting no matter how many times we read. So we went through those things for hours, and nothing new, and we didn't even try to like practice any stations on the last day, but just to brush up, and whatever we felt that each other we needed to like little things were lacking, so we just try to recall those things. That's it. Last 15 days we did recalls. That's what everyone advised us to do, and the recalls with each other, and whatever ambiguous things were there, I would say don't concentrate too much on exact things, because they're not exactly recalls like that. So rather than just keep practicing speaking with each other. That's what we did in the last 15 days.
No. Thank you, dear. And I want to know, like, what positive things or what things you're going to take from Race Academy, or this is not going to stop. I know that, but what benefits you got from joining our course, or and what things you're going to take back from this course?
Yes, ma'am. So I think the way I mean, each module you cover the most important stations, and there are only 6 participants. I feel that's the best part because it's not too crowded. Everyone gets a chance to speak, and sometimes someone is not there, so we present multiple cases in a session. So that is one of the best things. And how you people have these points noted down for each of the station, like and you try to cover everything in that, whatever in that station. So before the exam, it's actually very easy to go through the recordings and see, means that topic gets covered in that. Just going through the note, I mean the points that even Gitika ma'am, she says, I'll take you through the station now. And then she quickly
I
tells us
must
everything.
say, students are fan of her templates. You know, Gitika, you know that, right?
Yeah. And
They are actually.
that very helpful because everything is there in one place. You don't have to go anywhere else to look for that. And Siddesh sir's class, I still remember. He took a Urogani session for us, and it was almost towards the end, like the last but one session. And he was like so different. He just jolted us and told us, no, this is not what is to be said. You will be downgraded if you say this, and this is not that. And he brought a different perspective to the whole thing. So that was a wake up call for all of us. And we decided that we have to start streamlining our stations rather than just saying everything in all the stations. So yeah, that was also very good. And then yeah, the clinical governance part ma'am covered quite well, and she told us what is expected in from someone who's working in the NHS system. So those were the really great things. And yeah, the feedbacks that you give on the group, like whatever we submit, sooner or later the feedback will come. And
Yes.
especially
There's
Gitika ma'am.
always behind the people for that, you know. The moment it is submitted, I am just listening and her voice, the feedback appears and I'm like, okay, I will listen to
Yeah,
the next one. And she gives the feedback for the next one also. She's
yeah,
always on her toes.
yeah.
Yeah.
So those are the great things. And even in the library
And
ma'am,
actually, we
things
feel
that
that students they are waiting for it, no, Rashmi. So we should. I feel that I should give them as soon as possible because they
Yeah.
submitted with the view that
Yes.
what we have done right, what we have done
Yes.
wrong.
That's
So
very much
uh,
agree.
they really
And
feel motivated. Yeah, they really feel motivated with that.
yes, that's required because they want to know like whether they are going in the right direction or no, or what things have to be changed. And only when we listen to them, we are able to modify the tone. We are able to, pick up some sentences like, no, no, this is not the way you're supposed to say this. So the small corrections or minute things which have to be changed also, that matters a lot. The approach or bringing back that, empathy in the tone, everything matters. So I think this is all like, how you practice and how, like, as a team, we are going to work on this, right?
yes ma'am.
Yes,
Yes,
sure.
yes, definitely. And it was I'm really feeling so thrilled that one of our students have, and it was such a nice result this time, Rashmi. I know, and one of the students have got a gold medal, so that's glory to our academy also. And
Yeah.
we wish her all the very best in life. And
Yes, thank you and all the very best. We'll keep bumping into each other that we know, Smitha. We work together in Bangalore and, we're going to keep meeting each other. And Gitika, when you come towards Bangalore, do let us know. So we'll have some great time together
yes,
here also. And for all the
definitely.
candidates who are there, just I would say, believe in yourself. Just say that this is my degree. I'm going to get that. Keep saying that to yourself every day. And do not make it as some mountain or something that you are supposed to fear. It is just an exam. You are going to go there, appear, talk to 14 different people, either your role player or your examiners. Just talk to them and perform your stations and come. The more calm you're going to be, your mind is going to work. Trust me on that. So just relax and give your exam. Nothing to worry. And if anything else that you want to address, otherwise we'll wind up with the session. Any other questions students have? Lovely having all of you. A lot of students have joined us over here just to see how the approach was. Very nice. Thank you. Thank you so much for joining in. Thank you, Gitika. And thank you,
Rashmi.
Smita. Congratulations. Yeah, we are waiting for your that kind of a convocation photograph with your medal, dear. Thank you.
Yes,
Yes.
we will send it to you. And all the best to everyone. And if there's anything I can help out with anyone, if they can always text me or call me. So all the very
Yes.
best.
Thank you. Thank you
All the
so
best
much for joining in.
to you. Thank you.
Um,
Thank you, dears. Bye bye. Good night. Take care. Thank you.